Hey out there, and thank you again for joining me today on the Happy PharmD podcast. Today we have a special guest. She is a full-time practicing pharmacist, but also a pharmacist career coach with the Happy PharmD. So today we'll get a lot of helpful insight in terms of making career transitions and trying to find out what you're truly passionate for and eventually making that transition for yourself if that is what you are looking for currently with where you are now and where you trying to figure out where you'd like to be down the road. So I'd love to welcome pharmacist Julie Kidd to the podcast. Hello, everyone, and thank you for joining me today on the Happy PharmD podcast. Today I have pharmacist Julie Kidd with us. Welcome, Julie.
Thank you. Thanks for having me.
Thanks for joining us today. So let's just jump right into a quick bio about yourself, where you're from, where you went to school, and your career path to where you are now.
Sure. Yeah. Well, I went to pharmacy school. Well, I'm from Chattanooga, Tennessee. That's where I grew up. And then I went to pharmacy school, undergrad and pharmacy school at Samford University in Birmingham, Alabama. So I went to McWhorter School of Pharmacy. And then after pharmacy school, I did a PGY1 residency at University of Virginia in Charlottesville, Virginia. After my residency, I stayed at UVA and worked as a clinical pharmacist for several years in internal medicine and surgery. At that time, I was getting a little antsy in the way of pharmacy and didn't know what else I needed to do. But I actually took a year off of pharmacy, and I met my husband during that time, and we traveled down to Latin America right after we got married, 2 weeks after we got married. And did medical mission work for a year. So we did medical things and pharmacy things, but we were not getting paid for those things. But it really changed my perspective and changed my worldview a lot when I was down there and saw the things that we were seeing every day. And then I also, I came back and didn't know if I wanted to continue to pursue pharmacy or not. Primarily because of the need down in Latin America. I thought about going to medical school or PA school to have more of a niche in the developing country, but ultimately decided I didn't want to work that hard all over again after pharmacy school. So decided to pursue a master's in public health. And so that's what I did. We moved to Portland, Oregon after we got back from Latin America. I was working at Oregon Health and Sciences as a clinical pharmacist, but also doing my master's in public health there, which, just again, changed my perspective and my lens of how I viewed patients and population health and transitions of care. We did a lot of transition of care with this position, and it just really changed even how I educated and counseled patients through that public health degree. From there, and actually during my residency, I did not have the opportunity to do a teaching certificate program. So I was the residency coordinator at OHSU. And so I decided to do a teaching certificate with my resident, which I'm so glad I did. So then we moved back to Virginia after our time in Portland. And I was on faculty at a medical school at BCOM, which is in Blacksburg, Virginia. And I'm thankful for that teaching certificate because it taught me how to give a lecture and prepare a lecture and to be in front of students to teach. So I was on faculty there teaching pharmacology and our public health, our epidemiology course to both post-bac students and to first and second year medical students. And then I worked clinically in a patient-centered medical home, family medicine clinic, precepting medical students, seeing patients with hypertension, diabetes, et cetera, et cetera. Then we've moved a lot. That's the theme of our life.
I'm seeing that trend.
My husband actually, when I married him, sidetracked. He was a high school Spanish teacher. And when we moved to Latin America, he decided he wanted to go back and be a doctor. So he had 0 prereqs under his belt. So he had to do prereqs before med school and then training. So we've moved a lot because of that, but we're almost to the end, thankfully. So after med school, we moved to Winston-Salem, North Carolina, where I'm currently at. He was pursuing training at Wake Forest. And so currently, this is where I'm at now. I am a clinical pharmacy specialist at Novant Health. I am embedded into our multiple sclerosis center through Novant Health. It's through specialty pharmacy, but I see patients and counsel them. I order labs. I educate them on their medications and help them pick what's best for them in their life. I also am a CPP, which is North Carolina privilege, where I can prescribe medications and or labs under protocol and high position. So that's what I'm doing now. That was very long-winded, but that's what I'm doing now.
That's awesome. Well, thank you for that overview there.
Yeah.
And also on top of that, you're also coaching now, correct? Right?
I am coaching. Yeah, the Happy Farm D. Yeah.
So where you are now, compared to where you started, did you see a big difference in terms of like your life work balance in terms of where you were when you started as a pharmacist?
Yeah. Well, I mean, I wanted to quit. I did kind of quit pharmacy for that year, and I am residency trained. I was working in a hospital, so I feel like a lot of my clients, as a coach, they feel as though if they could just get a job in the hospital, or if they had just done a residency, then their life would be better. And I encourage them that residency is great. It does give you opportunities, but it's not the only way. So yes, I didn't have a lot of growth opportunity in that position. Still felt like I was using, my brain every day, but I just wanted more. And so once I got back, once I quit that job and went to Latin America, I think again, it just kind of changed what I wanted in life ultimately. And so, yeah, since then I've only pursued positions. Flexibility is really important to me. I have 2 small kids, and my husband is a physician, so he doesn't have a lot of flexibility. So I have to be the flexible parent. And so that is very, very important in our family life. And so yeah, I'm 100%, maybe not 100%, but I'm very, a lot more satisfied in my career and my job every day than I was, when I first started. And I try to encourage my clients. So whatever is important to you in your life, wherever you're at, if that's career, that's great. If that's family, that's great. But whatever is going to make you happy and whole as a person, then that's what we're going to pursue.
I love that. And I was going to wanted to mention really quick, back when you said you were giving lectures, it just brought back terrible memories of, I want to say the hardest class for me was an elective in pharmacy school for public speaking.
Oh, that's awesome.
And I remember that actually being like one of my hardest courses out of all pharmacy school.
That's awesome.
I was very shy back then and not very good at talking in front of large groups of people, even if it was a 30-person class or whatever. But
yeah,
I give you a lot of credit for being able to do that.
Yeah,
I give you a lot of credit for being able to do that. But what do you see as like the biggest challenge for people who, in our career right now, currently, like, I guess, to make that leap to be open to get coaching? What do you think is like the hardest, I guess?
Yeah, and I don't know
transition?
really to get coaching, but to, the clients that we have or I have, they just feel stuck. They feel like if they don't do a residency, or if they don't do a certificate program or get board certified, then they're going to be in this miserable job the rest of their life. And I try to encourage them that, number one, I feel like I have had a lot of great opportunities in my career, none of which have I been qualified for, like solely. And so, but I sent awkward emails, and I showed up to events to connect myself with other colleagues in my field. So just showing up and connecting with people in pharmacy, that can help you to meet people and for new opportunities, that there is a way out. You don't have to go back and do residency. You don't have to go back and do a board certification, but you do have to be willing to put yourself in a maybe vulnerable and awkward situation, to get out of your comfort zone. So if you're willing to get out of your comfort zone, then you can do anything, but I think we need to find out what it is that we want to do, before we can pursue that. So it's kind of useless to just spin your wheels if you don't really know what you're passionate about. So that's what we really spend our time at the beginning, is to find out what are you passionate about and what makes you tick. And then we can start, hustling and putting that work in. But my passion and kind of my path has been thinking outside of the box. And I think as a profession, pharmacists are terrible at thinking outside of the box. We are very type A. We like to, check boxes, and we're good at that. But I think what that leads to is burnout and again, no growth potential. And so I try to encourage clients, like, let's dream and let's dream big. Maybe it's not pharmacy at all. Maybe I have one client who stopped paying her pharmacist fee. She's not a pharmacist anymore, and that's fine. Let's figure out what we can do, without that. So, Yeah, I love thinking of kind of non-traditional things that pharmacists can do. We have such knowledge that we can give back. I think we're almost our worst enemies.
Gonna say, where did you have you always been that type of person, or did it take you a while to kind of be able to dream big per se, or to?
Yeah, that's a good question. Well, I think I was a trailblazer. I've always been a trailblazer. I think I got in a lot of trouble in high school. So as I've gotten older and more mature, and maybe my own children, I've learned to tame that a little bit more. But I think, it is a mindset I think you have to have of just, again, thinking outside of the box and dreaming big and asking questions that other people are maybe afraid to ask, or unwilling to step up and ask. And maybe the worst answer it can be is just no, but what if the answer is sure, let's try that, And so I think because I have experienced some of those, sure, let's try that. Can you show up tomorrow and do it? That's just encouraged me to keep going in that avenue, and to keep exploring what I'm passionate about, and kind of the next adventure in my life. So I think that is probably something that I was born with. Probably got me in a lot of trouble when I was younger, but is something that I know for myself, if I don't continue to pursue and hone in on those skills, that I'll end up where I was when I was working in a hospital, and feeling kind of stuck and bored, and not being me. I just didn't feel like me.
No, I think that's a huge thing you need to try and find a career that's you, that represents who you are as a person, not just, title pharmacist, but, as your
Absolutely.
individual personality and who you are. No, I love that.
Absolutely.
No, I feel like,
Yeah.
well, oh, sorry, go
So,
ahead. Yeah.
yeah, there's just so many opportunities out there for pharmacists that I think pharmacists don't know about, right? Like, I think all pharmacists, or most pharmacists I talk to, think that there's retail, there's hospital, maybe they've thought about industry, but there's so much more out there that we can do. Again, we just have to be willing to kind of show up and put ourselves sometimes in situations that we might not be the most experienced, but just showing up shows so much um, to put yourself out there, and it's going to just push our profession, as well as you personally, to get out there and do things that other people aren't doing, or maybe just scared to do. But you're going to continue to do that, and you're going to like make big waves and leave other people behind that are still burnt out, and wishing that they had stepped out in courage to do those things.
No, I completely agree with you 100%. I feel like burnout's a true thing, absolutely, especially in our profession, and especially if you're in one of those industries, more retail. I mean, it could be in any field, but retail, hospital, anywhere where
Yeah.
your hour, a lot of hours on your feet, overworked, high volume.
Yeah.
But I feel like, taking that risk, especially, getting out of your comfort zone, networking is a hard thing for a lot of people. And I feel like that's probably step one right there, is to just get your name out there and make connections. It's huge.
Absolutely. Yeah. And, I feel like connections and maybe COVID has made it a little bit easier too, but connections can be somewhat simple, or it could be more safer, if you will, behind a screen. So like making a LinkedIn profile and connecting through LinkedIn, or, sending emails, asking someone, hey, can you tell me your career path? How did you end up getting to where you are now? Everyone loves to talk about themselves, right? So if you send emails and ask for connections about someone to talk about themselves, usually they're going to do that. So even if you aren't kind of born naturally to go out and face to face talk to people, I think technology has made it a lot easier for us to do that. But yeah, just showing up, and putting
No,
yourself
yeah,
out there
absolutely.
is kind of the name of the game right now.
And you don't have to buy them coffee right now, because you
Yeah,
can't.
right.
Right? You can give them a
That's
gift card. Give them
exactly
a give them
right.
a give them a gift card to Dunkin' Donuts or something.
That's
But
exactly right.
but no, I wanted to go really quick back and revisit what you said about how, especially in this day and age, you can really create your own job. I feel
Mm,
like even if you reflect back to, for me, 5 years ago when I graduated, and when you graduated, there was a lot of jobs that you're seeing now. Even pharmacy coach really didn't exist. I feel like it was something that has been created. It's not,
mm,
a position that I honestly wouldn't have thought of, having that option to be a career, or really anything. If you became your own entrepreneur as a pharmacist, or it could be something completely unrelated to pharmacy. But I feel like, especially in this day and age with technology, and especially now with everything going on with COVID, you have, a lot of time to think about it and to work on those projects you never got to or thought you had time before. So I feel like there's
Absolutely.
so many options out there that a lot of people haven't even thought of yet, and to solve other people's
Absolutely.
problems. So
Yeah, exactly. And I think if you do, yeah, I mean, my current role, I don't think 10 years ago, 5 years ago, there was a pharmacist embedded into a multiple sclerosis clinic. That's a new thing for pharmacy, to have clinical pharmacists in these specialty clinics. Clinical pharmacists have been in primary care clinics for a while, but not in these specialty clinics. So, our profession is evolving, and I work with a large organization. So there's opportunities there. But then if you do want to do something kind of on your own, just like you said, I mean, it's up to you, what are you passionate about? What do you want to put the time and energy in doing? And because, of all this telehealth, you can do it from wherever, right? And have that flexibility and work-life balance. And you can be sitting in the beach in Hawaii,
yeah.
reviewing charts or counseling patients, or maybe something completely non-pharmacy related. So, but you have to put in the work, to
Yeah,
do that.
it might be difficult in Hawaii to do that, but just a little. It might be a little distracting. I don't know,
That's
but
true. That's true.
but I did, for those listening, especially if anyone lives in North Carolina and they're curious, do you mind just quickly giving a little information about CPP, like how you got that role and what you had to do to get there, and what exactly you do now with that title?
Yeah, absolutely. So in North Carolina, and there might be other states as well. I don't know of any other states, but if you have certain credentials, if you've been out of school practicing for so long, if you have board certification, you have the credentials to get your clinical pharmacy practitioner license. And so you actually go through the Board of Medicine as well as the Board of Pharmacy, with a protocol, so like a collaborative practice agreement that you and your attending physician agrees upon. And that collaborative practice agreement are sets of medications and labs that you as a CPP can prescribe and order. And so I'm essentially a mid-level provider. I see patients and adjust medications just like a nurse practitioner or a physician's assistant would. So it's a really cool thing. I have a lot of free reign under my attending and my protocol. So you review that and renew that every year, and it goes again through the Board of Medicine and the Board of Pharmacy. It's not too bad to get credentialed as long as you have those certain steps. And there's different categories. If you've been out of school for so long, if you have board certification, if you're residency trained is like one of the boxes. There's many different boxes of how you can get CPP'd. But it is a really neat thing. I do a lot within our clinic for MS patients of treating their symptoms. I help them when they first get diagnosed to pick the medication that they want to use that kind of fits with their lifestyle. But then along their journey, there's lots of symptoms. MS is a disease that doesn't have a cure. And so there's lots of symptoms that go along with that during their journey. And so I meet with them and by video or in clinic or by phone and talk about those symptoms and treat their urinary tract infections, treat their neuropathy, treat their incontinence. And I don't have to send that prescription to my physician. I can just I just prescribe it myself and then monitor the labs. So it's a really neat thing to have, and it leverages me to, work at the top of my license. It's been this has been around for a while for primary care pharmacists, but it's kind of a newer thing with specialty pharmacists working in specialty clinics. And so it's been a really neat adventure to take. I was one of the first ones at Novant Health to get it, but it's been really helpful for our patients, especially when my physician, he's booked for 6 months that they can see me and I can help manage some of these symptoms pretty quickly. So it's been great.
No, I love that. And that's such a cool, like you can make such a big difference and the patient doesn't have to wait to get to the specialist, or to the doctor, I mean,
Yeah,
which is
absolutely.
awesome. Like that, I know, especially to get into a doctor at that kind of level, like it takes a long time for
It
especially,
does.
yeah.
Yeah. And the first few patients, and every now and then too, my patients will look at me and say, "A pharmacist, what are you doing here? You should be at the pharmacy dispensing medicine." I'm like, "Well, those are my colleagues, but I'm here helping you with your symptoms here. And we all work together." So it's educating them too on kind of what pharmacists can do with.
Quite a
Yeah,
range of specialties we can, or a
absolutely.
range of things we can
Absolutely.
offer. Absolutely.
Yeah.
No, I
Yeah.
love that. Well, thank you for that explanation. Especially, I know a lot of people are probably like, "What is that exactly?"
Yeah.
Especially
Yeah.
if they're
Yeah.
not
Yeah.
in North Carolina. But no, I
Right.
think it's such a cool thing we can do in this state.
It
Um,
is.
and just to transition back to coaching quickly. For those out there, especially now with the COVID-19 going on, um, one could argue this may be the best time to make your transition in your career. Um, for those that are thinking about doing that, what would be some words of encouragement and advice you would get on top of the in terms of networking and just trying to figure out what you'd like to do. But I'm sure there's a lot of fear, especially to make a change, especially now. But what are your thoughts with that?
Yeah, yeah, that's a big question. And I've had some clients that say that it's just not the right time, and some clients say it's the perfect time. And I personally, well, I think now, North Carolina, we're opening things back up in phase two, and I'm starting to see jobs pop up all over the place, which is great and encouraging. And so, when people reach out to me now and they're kind of like, "I don't know if it's the right time," I say, "Well, we don't know. We don't know how COVID is going to be in 6 months or a year, but now's the perfect time to at least figure out what you wanted. If you're miserable right now, why wait? Number one, why wait to figure out what you want to do? And there's other people who are miserable, and once those jobs do start reopening or new jobs are created, um, we want you to be the first one, with that resume that looks beautiful, with all your connections, with making sure we know what you want to do, so that we can hustle and get that job that you want. So it's I feel as like it's a perfect time to put in some work, to figure out, number one, what makes you tick, how can you connect that with pharmacy, and then hustle to get that particular job right now. So when things do open up and there's new opportunities, you're first to the game, and you have it all together. We practice how to do an interview and how to connect with people in that field. So I think it's a perfect opportunity to do that. But I don't think that we don't know what COVID is going to do, or how it's going to affect us all. But I think, again, like we've talked about, I think there's going to be a lot of new opportunities with telehealth and pharmacy. It's just uncharted territory for us. But even through Medicare, Medicaid, with reimbursement and billing, like just so much that we don't know, but it could be such an advantage. So let's figure it out, and let's open up opportunities right now so that you're ready when jobs do open up, or new adventures in entrepreneurship open up. Like, let's do it.
Yeah. Yeah, I think you're 100% spot on. We're probably going to see a lot of remote pharmacists position and opportunities coming up, I would say, especially with everything kind of changing, this like new world we're going to be seeing. Yeah, I think you may see a lot of options where that may help a lot of people with their work-life balance. So to be able to work from
Absolutely.
home, or to pick their schedule potentially,
Right.
or live wherever they want. Maybe
That's
really
right.
cool opportunity
Hawaii.
also.
Let's go to
Hawaii.
Hawaii.
It sounds like you're planning a vacation to Hawaii or something pretty soon.
I wish. I wish.
I've never been, so one day, hopefully one day. But
Yeah.
no, I feel like another big thing as pharmacists too is we're very stubborn to ask for help. I feel like
Mm,
you may keep applying yourself and just not getting any traction, or you feel that maybe your position isn't, maybe what you're currently doing isn't that bad, or maybe you just don't think you're going to find anything better.
yeah.
But I think the best thing is, as coaches, we can kind of help you think outside the box. Number one
Absolutely.
is something that you may not have even noticed, it's right in front of you, but it could be something very simple, as you just never need a second pair of eyes to see it, and boom.
That's
So
exactly right. Yeah. Yeah. I mean, kind of explore some of these things that like you said, has never really even, you knew they were inside of you, but you've never opened that up, and so having someone to ask you some hard questions, to really process some things with you, and for you to say that out loud, it can be really powerful for clients to really say, wow, that is, I've always thought that or felt that way, but maybe I can actually do something about it,
Yeah. Yeah.
So yeah, I love that. I love it when the lights go off and you connect those dots and it's like, oh my gosh, that's, I could love my job because this is who I am made to be, and I can connect pharmacy in that way. So cool.
Yeah, no, absolutely. And while we wrap things up quickly, especially if anyone wants to reach out to you or, learn any more information about us at the Happy Farm D, how can they find you?
Yeah. You can, I'm assuming you'll put notes together from this podcast.
Yes. Yep.
You feel free, you can email me. I can give you my personal email or my work email, either one. You can find me on LinkedIn, but I'm happy to connect with anyone who has any questions about, my crazy career or coaching or what have you. Feel free to reach out in any way.
Awesome. Well, thank you so much, Julie, for being on the podcast today. It was awesome to have you on.
Absolutely. My pleasure. Thank you.
Awesome. Thank you so much. Well, thank you again for joining us today on the Happy Farm D podcast. I hope you got a lot of useful information from today's interview with pharmacist and career coach Julie Kidd. I really think it's helpful to really assess and think and reflect to what it is that really, using the words from Julie, what makes you tick. And in terms of determining what type of career path you really want to make a transition into from where you currently are, I think it's truly important, that you to find something that you're truly happy with. You can find that healthy work-life balance, and find something that if you truly are stressed and feeling overworked and just really don't enjoy what you're doing, you're not alone. There are plenty of us out there that feel this way, and also plenty of us out there that want to help you make that transition to the next career path that you truly enjoy and find that happiness and new spark in your career. So please feel free to reach out to myself, Julie, or any of us here at the Happy Farm D. We're more than happy to talk and help. And thank you again for joining us today, and we'll see you next time.